So what was your most memorable experience serving as president?
I think it was during my presidency, the American Board of Dermatology first got recognition for surgery as part of the specialty in a formal way, was tested for by the board, and it basically lended official credibility, so to speak, to us doing surgery.
What were the issues facing the society during your presidency?
It basically was trying to form some cohesiveness and togetherness around the acceptance of surgical dermatology within mainstream dermatology itself, let alone fighting with the outside specialties that didn't want us to be doing surgery. I think, we succeeded in bringing together a really talented group of people at the time to work within the confines of the society, bring the society in an accepted way into the Academy of Dermatology, and set the kind of guidelines for where our future would be going.
What were the most significant innovations in dermatology during your year?
At that time, it was the beginning, I think, of filler substances. Zyderm, which was a cow collagen, was approved first in California for use, and then we were able to take it outside of California. Those of us who, I trained in California and then went back to Michigan, and we were able to begin to use it, and it was kind of set the revolution for injectable fillers, that now it's hard to keep track of how many they are and where you place them and how they're used.
Do you have a most memorable patient?
Yeah, my most memorable patient was a failure. Was a really nice gentleman in his mid-50s, was sent up from Eugene, Oregon with a big tumor on his nose that had been misdiagnosed down there as rosacea. And it really was an angiosarcoma, which is a very aggressive tumor. And I worked with our head and neck facial plastics people and resected that tumor. And literally within a week, it had recurred along the resection margins. And within 10 days of his arrival, he passed away. And it gave me a real appreciation of why we do what we do, the fragility of what we do, and certainly an understanding of that particular tumor and how aggressive it can be.
In looking back at your career, is there anything that you would have changed or done any differently?
That's a tough question, because I think most of us have enjoyed our career. I think those of us, I know you've interviewed some other people my age, still enjoy what we do, or we wouldn't be doing it. And so we've been fortunate to practice a specialty, a subspecialty that we really enjoy. If I had to do anything differently looking back, I would have traveled a little less and spent more time with my family. Because I think that's kind of what suffered for all of us who grew up in that era, because surgery was in its infancy. And if we didn't go to the meetings and be the spokespeople, no one was going to. And we kind of had lost a generation right above me, and Sam Stegman and Ted Traumovich and Bud Menn, who passed away, and left kind of that generational gap. And so for some of us, it was getting to those places before we really were at an age where you normally would, or may even have been ready for.
What advice would you give today's young dermatologic surgeons?
Stay up to date, and be ethical. There are increasing pressures, I think, for the business of medicine in its relationship with how we practice. And I've preached ethics for my entire career with trainees and anybody that would listen to me. And I just hope and fear a little bit, but I hope that the people who come up behind us will maintain the ethics of what we do and the standard of care of our practice.
What are your predictions for the future of the specialty?
I think the future's bright. I think we're going to see, we're seeing already innovations that some of us predicted a few years ago, but no one really would listen to us. I think we have to be prepared for multiple ways to treat skin cancer. I think we just had a drug approved 2 weeks ago to treat metastatic and advanced squamous cell carcinoma. And so, we're going to have medical advances and things that we can do to break away from what I call the surgeon's mentality, because as we grew up, you cut it to cure it, and I think that we're going to get beyond that, fortunately.
Do you have any advice for the ASDS leadership in serving its membership in the future?
Continue its educational mission. They do a really outstanding job at that, and they're advancing the way they do that as technology has increased beyond my gray hair in understanding in ways that have reached out to their members and the public. Dermatologic surgery is now a household name. When I was president and when we were growing up, we were fighting for people to understand who a dermatologist was, let alone a dermatologic surgeon. And I think we're well past that.